indicated to Senator Kelleher and Deputy Smith in your absence that they could come in, and then I'll come back to you. Is that okay?
How could you do anything in my absence? I can't understand, Chairman.
Senator Kelleher.
Thank you very much, and I will be brief because I know that others want to come in, and I want to thank everybody for your presentations. Dr. Boylan, you said the timeline is challenging. I mean, it certainly is for women when they find out that they're pregnant. The clock starts ticking in a very real way. It's challenging for the women who are taking the pill today, as Deputy Coppinger referred to, and Deputy O'Connell, an estimated 1,000 women, we think, women travelling to the UK, which has been going on for years and years. We waited 35 years for what happened yesterday, so the timeline is certainly challenging, and 66.4% voted for change. So given that time is of the essence for women, how can we as lawmakers work with you in the colleges to make sure that there is no undue delay, for example, in the drawing up of the guidelines that you mentioned, Dr. O'Brien, and do we need some formality on that? And I'd like you to comment on that. And again, going back to the 3-day interval, given that, you know, Dr. Boylan and Dr. Murphy, you clearly said in your paper that it is not supported by evidence. Well, surely there is a case that that shouldn't be in the law. Is that what you would recommend, that we avoid putting that into the legislation? I'd like to hear from you on that. And also, if you haven't already, would you be willing to write to the Minister for Health asking for an urgent meeting of all of the stakeholders, which should include women, which should include the Irish Family Planning Association, as well as the HSE and all of the various colleges and the doctors? Would you be willing to write to the Minister for Health calling for that leadership and that stakeholder leadership to happen? They're my questions.
Thank you, Senator Kelleher. Dr. O'Brien.
Could I come in on that? Essentially what you're asking is how can the legislators help with regard to the implementation of this service in as expeditious a way as possible. I think that you're all pretty well focused on that from the comments that I get around the table today. And I suppose the areas that do need attention are the areas of the framework within which all this will operate. And that's a planning issue, that's an issue to do with the HSE, it's an issue to do with the Department of Health. It will also be important that this is sufficiently resourced, and ring fencing of the resources has been mentioned already. And there is a whole question around capacity. So the actual providing the people and the equipment and the buildings and the beds to actually deliver this service, both in primary care and within the hospital system itself. The guidelines I think are moving along very nicely, but once again the legislation is important in order that the guidelines map to the legislation, and also we need to know what this will look like so that we can map the guidelines to what there is. It's an iterative process, and we've already spoken earlier on there about getting everybody in the room. I think that is something that you could possibly promote as well, and would also say that apart altogether from ourselves, and we have been in the room, what the people who have not been in the room, and this probably pertains particularly to general practice, is those who will discuss terms and conditions and how all that piece of it will work, and funding going into general practice, because general practitioners are outside of the normal HSE structure, so they are separate, and all of that will have to be brought in as well.
If I could have said that, Senator Kelleher, I think one of the most significant things that would give reassurance to the women of Ireland, our patients, was if they received a commitment whether that's in legislation or in regulation, that there will be a timeline attached to when they can expect to receive a service. So, for instance, in Portugal, where they don't have any mandatory waiting period, it's written into their regulations that they must receive a service within 5 days. In Holland, for instance, where they do have a mandatory waiting, the waiting time starts from the moment the woman picks up the phone. Those types of things. But it would give great reassurance to us as potential providers for us to know that the department has our back, which is that there will provision within a certain time frame. It's not for us to suggest what that time frame would be, but this is a particularly timely issue, unique in medicine, and it is, as you said, the clock starts to tick for women, but unfortunately it's going to start to tick for providers too. And we are going to be faced with the additional burden and responsibility of how do we shepherd these women through these clinical care pathways, and who's responsible for them if they fail. And that is exercising both general practitioners and obstetricians, and obviously nurses and family planning clinics who may be involved in it.
I think with regard to the Minister, I think he's probably fully aware after today's hearings of the urgency of getting everybody around the table at the same time. And with regard to the 3 days, that's a matter for the legislature. It's up to you guys to, you know our feelings about it, that it's unnecessary and demeaning to women to suggest that they have to wait 3 days to make their minds up. Take that as a yes, but it's the legislators who can fix that, not us.
And sorry, Chair, just in addition to that, I don't think anyone went out in the referendum and voted, oh geez, yeah, 72-hour waiting period was high in their minds. It's just I've heard that argument being used. So.
And Senator Kelleher. So now, Deputy Breed Smith.